So you are a veterinarian and you have a more holistic focus for pets. Is that correct?
Yes, that is. Yeah. Mhm.
Awesome. So what was it that kind of made you realize you wanted to be more holistic centered for animals rather than just traditionally treating them?
Well, when I first graduated vet school back in 1991, I started practicing medicine, a little bit of surgery, not much, and I was quickly dismayed on how often animals were kept coming in for the same problems over and over again. And I would give them medicines or drugs. The problems would either go away and then they'd come back, or they'd have side effects from the medicines. Or we would suppress the symptoms, and then the symptoms would go deeper into the body and manifest as a more serious internal condition. And so, that got me thinking, hey, there's got to be more and more cancer, more and more autoimmune problems, and, younger and younger animals. So I decided, back then that, there was a better way to look at health and disease. And so treating disease. And so that's when I started, learning more about holistic medicine, homeopathy. And yeah, that kind of got me on my journey.
That's awesome. And yeah, I'm sure back in like the 90s that was even more rare to want to do more of a holistic approach
Yeah. Yeah. It
for
wasn't like,
medicine in general, whether it's for people or for animals.
right, exactly.
Yeah.
Yeah. Yeah.
That's
So,
awesome. And so I guess there's a few topics that I want to cover, and
yeah.
so I might just start throwing them at you.
Okay. Yeah.
The first being food. Obviously, when it comes to people, I work with people nutritionally, and obviously, I tell people to eat as whole foods as you possibly can. You don't want to eat things that are packaged and processed.
Right.
And uh, I have two dogs of my own, and I realized that I should be applying that same philosophy to what I feed my dogs, and I was feeding them kibble. And so many people do, and obviously like sometimes that's what's financially feasible, but
Right.
ideally what should we be feeding our dogs if not the processed kibble food?
Yeah. Well, I mean, dogs and cats evolved to eat, species appropriate fresh meat, raw diets, rotating the proteins.
Yeah.
In other words, not feeding the same protein every day. We don't eat the same proteins every day, and neither do our animals
Yeah.
in the wild.
Yeah.
And so, feeding them a rotating raw meat protein diet keeps them healthier. Feeding the same, actually can lead to allergies and gut immune reactions over time. So we want to vary the protein sources. And, I there's several ways of doing a fresh meat raw diet. There's a lot of different, techniques and philosophies, even to some degree, on the proportion of meat to, either vegetables or some grains. Some people will do a balanced, fresh meat diet.
Yeah.
My teacher in veterinary and homeopathy, Dr. Pitcairn, he actually, in his original editions of his book, had mostly balanced, and he was one of the first people in the country to preach a raw diet back in the late 70s when his
Wow.
first edition of his book came out. And
That's
so the
awesome.
early editions of his book actually are more balanced meat, grain, veggie type fresh diets. And, just changing them to that off of processed kibble, we often see problems going away. A lot of, skin, ear problems, healthier coats, that kind of thing, and better digestion, smaller stools.
Yeah, that's a big one that I
Yeah.
noticed when I switched my
Yeah.
dogs to raw meat.
Yeah. So Pitcairn's original philosophy was a more balanced, meat, grain, and veggie type diet. And then over the decades, people started looking at it and saying, well, maybe they shouldn't be really having too many carbs because, they are omnivorous or carnivores, especially cats.
Yeah.
And then people started exploring what is known as the BARF diet, which is the
Okay.
biologically appropriate raw food diet, which is a philosophy feeding mainly meat, bones, and some organs, and a little vegetable matter, and minimal carbs. And
Yeah.
so there's a philosophy of just going more in that direction. And so some animals do better on, one or the other. I mean, again, it's just like us, not every person should eat the same way that another person eats. We all have different, body types and blood types that probably require different, nutrients. or not different nutrients, but different balance of nutrients.
Right.
So,
Yeah.
those are the, so the pit caring approach, the fresh raw meat diet approach. There's more and more, available now. Back in the, 80s and 90s, that people had to go buy the meat in the store and chop up the bones and do it themselves. But
Yeah.
now there are, a lot of good resources of a fresh raw meat diet that, you can get. Local holistic pet stores are carrying them, in their freezers. You actually have, sources online that you just, can easily just, buy. I have several brands I'll often suggest to people if they, can't find one locally, that they can get online. So, there's resources down here in Florida. There's a good company I use in Pompano
Okay.
called My Paleo Pet. They ship all over the country. They're a very, very good resource. They have, human grade meat, which is, great because it's pesticide free, hormone free, antibiotic free raised animals. And so
Yeah.
they're one of my favorite resources that I go to down here in Florida. So, you know, there's a lot of resources out there. Uh,
Yeah.
Pitcairn in the later editions of his book, actually went more vegetarian with our animals, which I'm not a real big proponent of, but he makes the case for the source of the quality of the meat these days, the amount of GMOs and heavy metals and pesticides, even in healthier meat. And so the higher we eat up on the food chain, whether it's us or our animals, the more concentrated the toxins become. And so, some people that are more ecologically oriented or just, have explored vegetarian diets, and his in his book he does have recipes in there for that as well. And some animals can do very well. Cats can, not as much because they're carnivores and they need meat. You can't really make a cat a complete vegetarian, but
Yeah.
there's a lot of philosophies out there, and I often encourage people to explore what resonates with them and their belief systems, and then try it and see how it goes. And as I
Yeah.
said, the health conditions that improve are amazing. A lot of times, chronic illness just goes away. Tumors and lumps get smaller, that kind of thing. Healthier, all the way
Yeah.
around.
That's fascinating. That's funny you mentioned the vegetarian. So at this dog park that I go to here in Los Angeles, I met a woman and her dog was there and she was telling me how her dog is vegan.
Right.
And part of me was just like, the poor dog, because to me, okay, maybe dogs aren't as much of carnivores as cats are, but to me, I would still look at a dog and be like, yeah, they're carnivorous, like they need meat.
Yeah.
But I mean, interesting. I didn't even know that people have looked into vegetarian diets for dogs.
Right. Yeah,
So,
no, there are books and recipes out there, and especially in smaller dogs and cats, not cats, smaller dogs,
yeah.
that if they ingest a lot of heavy metals and other, GMOs in a high meat diet, sometimes it can affect their health neurologically, behaviorally, sometimes seizures, especially from the heavy metals. And so, sometimes in those cases, exploring a plant-based diet might be worth it. As I said,
Mhm.
that's not my first go-to. It's not,
Right.
obviously what their teeth evolved to gnaw into.
Yeah.
It's not the way their digestive tracts really evolved to handle.
Mhm.
Their digestive tracts are much shorter than ours and evolved to eat, meat, raw meat. Uh,
Yeah.
the more it's cooked, the more that destroys the nutrients in the food. The processing of kibble and canned foods, destroys nutrients. So does cooking the protein. So doing a fresh raw meat diet is, or following a raw meat diet recipe is definitely the way to go. And it's like Hippocrates, the father of medicine, said, "Let food be thy medicine, and medicine thy food." Yeah.
Absolutely. Yeah. Yeah, so I'm in California, but the food I feed my dogs is the company's called Raw Canine and they're actually based out of Florida and they
Oh,
have like complete meals and it's like they have different protein varieties with different meats and then they have the organs and small bone pieces in there so it's a complete
right,
meal. So I found that has just been really convenient. And yeah, they ship it to me frozen and I'll stock
right,
up for a while. Yeah.
right. So yeah, I mean, there's definitely the way to go. And as I said, and then when we put our animals on the fresh meat diets, a lot of times their bodies do some detoxing or house cleaning. So they'll get a little bit of diarrhea for a little bit, or a little, or even some skin eruptions or discharges through the ears or through the eyes. and that's just the body getting rid of some toxins. And often people, when they change to a raw, if they're not familiar with that concept, if they get diarrhea, they'll say, "Oh, my dog or cat couldn't handle that." Well, their body was just doing what it needed to do. So
Which makes sense because humans are like that too. When I work with people and they switch their
right,
diet and they start eating cleaner, they will have loose stool for a while because their body is starting to purge things. So it makes lots of
yeah,
sense that a
yeah.
dog would go through the same thing when you're changing up their diet as well.
Right, right. So it takes some patience sometimes, and as I said, working through the symptoms. In holistic medicine and especially homeopathy, symptoms are not looked upon as the bad guys. They're looked upon as the body's way of trying to restore health and balance. So,
Yeah.
mhm,
Yeah.
yeah,
And I would imagine, like, obviously, one of the things dogs have so much today is allergies, which I think that some of that is probably from over vaccinating our pets, which is something I want to talk to you about as
yeah,
well. But
yeah,
I would imagine a lot of that is from the nutrition too, because I noticed like my dog's paws used to be super, super itchy, and then I switched their food, and now they don't really chew with their paws anymore. Maybe once in a while if
right,
there was
right.
like something going on outside, but very rare.
Yeah, yeah. Well, I mean, again, the allergies are huge, and the quality of the food. A lot of these, there's these big pet food companies that brainwash young veterinarians and veterinarians in school. That's sells expensive foods in bags and cans, and if you look at the ingredients, a lot of times they're cheap grain sources of protein and meat byproducts with a lot of fillers in it
Yeah,
and other byproducts and flavor enhancers and non-wholesome ingredients. And one of my colleagues called it the 4 Ds end up in processed commercial food. The dead, the dying, diseased, and disabled animals that are rejected for human consumption
yeah.
often end up in a bag or a can of pet food. Even euthanized animals have been shown to that sometimes
Wow.
the euthanasia services when they cremate animals or they get animals, they often will you end up putting them in dog or cat food.
That's
Hopefully not
crazy.
often, but it's been
Yeah.
yeah,
It's
yeah,
happened. Wow.
yeah,
And then I would imagine too, if they're not using quality ingredients, like if they're using, I don't know, like grains and stuff that are probably heavily sprayed with glyphosate too, that it's being
yes,
used
yes, yeah,
in pet food. So,
absolutely, yeah, yeah.
wow.
And like I said, that's the most important thing someone can do to have healthier animals is to get them on what they evolved to eat
Yeah.
and do that. And there's also some other options out there. There's what are called freeze dried raw, which is where you just add water to but it's still to a powdered diet, but it's still
Right.
processed. That's what
Yeah. Of
allows it to go into a powdered formulation. So, you know, freeze dried is obviously better than, commercial canned and kibble food, but
course.
it's definitely, a step down below a fresh meat diet. Yeah. Mhm.
Yeah, definitely. What do you what are your thoughts on like giving your dogs like raw meaty bones or like bone marrow bones?
I think that's wonderful. I mean, that's how, giving them marrows and raw meaty bones and beef backs and chicken backs. I mean, that's the way they're the best thing for them for their teeth and their gums. They chew on those things. It's a natural cleansing effect on the teeth. The tartar often falls off.
Yeah.
Um, you know, years ago, decades ago, it was rare to see an animal with dental disease. It just was rare. I mean, it just wasn't, and now it's a whole specialty in veterinary medicine, and so expensive to have a animal get their teeth cleaned with X-rays and
Yeah.
extractions and all sorts of chemicals and drugs and medicines given to those animals because as part of the dental process. And dental disease or gum issues are a result of often chronically poor diets over again generations. But
Is
that's
there a link to their gut health as well with their teeth health? Like if
absolutely sure. There's
yeah,
a biome of the mouth that a healthy biome. One of the latest kind of fads, or I should say movements in holistic vet medicine, is to actually supplement sometimes some animals with some probiotics that were developed from healthy flora of the mouth.
yeah,
So, yeah, the digestion process starts in the mouth. It goes from the mouth to the anus. It starts right in there. And
yeah,
so clients that tell me, well, my animal should be on, shouldn't he be on kibble because cleanses their teeth. And kibble's mostly carbohydrates,
Yeah.
processed carbohydrates. So that would be like your dentist telling you to go buy some cereal and chew on it, and
Yeah.
that'll get you a healthy mouth. But yeah, it's the opposite. It leads to more dental decay and disease. So
That makes sense. Yeah.
diet formulation is so important. And again, the commercial pet foods are just loaded with so many toxic ingredients and preservatives. And with cats, they use a lot of flavor enhancers, especially to get them hooked on kibble. Just like fast food restaurants get us hooked on.
Oh God, yeah, addicted to it. Yeah.
Yeah, yeah. So
Definitely. And would you say too, like a lot of the kibble is why there's a lot more dogs that are overweight? I mean, I'm sure some of that has to
absolutely.
do with people not being as active and not getting their dogs out, but I would think food plays a huge role too
Oh,
in
sure. I
their
mean,
weight.
obesity, I mean, it's a multifactorial issue in animals, when we look at their health holistically. But yeah, the kibble and the carbohydrates make them gain weight just like it would a person. And, obesity also has, weight gain also has a lot to do with, hormonal influences in our animals. So, for example, most animals that are spayed and neutered, especially at young ages, they often develop obesity and all sorts of other hormonal and bone and joint issues and certain cancers, just from removing the sex hormones. So I just would bring up that as a
Yeah, that was one of the things I wanted to ask you about because I have heard you should wait until they're at least a year old. I know some data even shows you should wait till they're 16 months old to have them
yeah.
spayed or neutered. So what's your opinion
I
on?
mean, I recommend waiting as long as you can. The older
Yeah.
the better. And in my opinion, if you have a boy dog or a male dog, I personally wouldn't neuter them. I think there's more downsides than upsides. Neutered male
Interesting.
animals are more prone to, all sorts of cancers like bone cancer and hemangiosarcoma, which is a cancer of the blood vessels. Um, they're more prone to, as I said, bone and joint issues. Prostate cancer, which people used to think, hey, neutering them prevents that.
That's what I was gonna say. That's what I had
Actually,
like always thought.
yeah, most cases of all the cases of prostate cancer I've ever seen in my career have occurred in the neutered male. I mean, in the neutered male dog.
Wow.
So, prostate cancer is definitely, uh, you know, something that's increased people often aren't aware of. So, and even behavioral issues, people say, well, neuter or spay them to calm them down. And actually, animals that are spayed or neutered have more behavioral issues, anxieties, aggression, certain types of aggression. So the research and the clinical experience actually shows the opposite of, again, what people were taught in the beginning. Yeah.
Yeah. That's so amazing. I mean, and I should have known even that not neutering your dog is better.
Right.
Uh, but yeah, I'd always heard that, yeah, you want to neuter them. It's better so that they don't get certain cancers when they're older. But
Right.
I mean,
And then when you remove the sex hormones, because the hormonal systems of the body are an integrative functioning unit, you
yeah,
affect all the hormonal systems. So dogs that are neutered or spayed, again, are more prone to low thyroid issues. They're more prone to adrenal gland problems. So the endocrine system works as a whole because when you
right.
take out those sex hormones, you affect, again, the globally the health of the animal. So, it's really a procedure that I would encourage people to, put off as long as possible. And if, as I said, with male dogs, I try to recommend not doing it if you can. Now, there is a type of uterine infection female dogs can get called a pyometra, which is an abscessed uterus.
Okay.
And that's actually, it can be a pretty serious condition, but it's treatable by spaying them. I don't usually see animals die from it. They can get sick.
Yeah.
Um, in holistically raised animals, I rarely see the uterine infections, but it's a possibility. And then the other, thing with female dogs is, breast cancer. There's some influence that the sex hormones have on promoting, excessive growth of tissue in the mammary glands. But again, I find that mostly in, animals that are raised on commercial foods,
Yep.
uh, over vaccinated on, a lot of pesticides, preventatives. So I don't really see that as a major problem like breast cancer in my intact, uh, patients, female patients. Of course, with cats, it's a lot more difficult to live with a intact cat. So, usually you want to because they go through heat so many times uh,
Yeah.
a year. So you want to just maybe get them spayed, at a year if you can wait. And same with the male cats, to live with a male cat and the odor and the spraying is
Right. Yeah.
not easy. Yeah.
Yeah. Well, that actually really makes me rethink ever getting my a future dog neutered. Obviously, both of my dogs are neutered, and my first dog that I got, I was young, I was in college, and so I wasn't
Right.
really very well versed. So I was just doing whatever my vet told me. So I think they
Sure.
even suggested me doing a procedure where they inject the testicles and they don't actually remove them, and it's supposed to stop
Uh,
them from producing, but I
yeah.
don't think it worked. I don't know. So he ended up getting actually like fully neutered later on. But I
Well,
was
the
like,
movement in the future, they're saying, is the teaching young veterinarians and veterinary students more to do what are, like ovary sparing and testes sparing surgical, sterilization. So with males, that would be a vasectomy, and
okay,
with females, it would be, removing the uterus and leaving the ovaries in. So, there are more and more veterinarians, hard to find still, but more and more
yeah,
veterinarians that are, offering those services as well.
that makes sense too. That actually, yeah, that would be maybe kind of like a happy medium. So where you're
Yeah,
not fully doing it, but you're still then preventing them from,
yeah, yeah.
yeah,
And a lot of bone and joint issues. I mean, there's a epidemic orthopedic issue that occurs in dogs called a ACL, or a cruciate ligament issue. And that's, a tear of the ligaments and the menisci that make up the knee joints.
okay,
And people used to think it was trauma or as an injury, but it actually is an immune destruction of the ligaments of the knee, and the hormones have been shown to be protective with that. So again, and it's a very expensive, surgery to have to, put an animal through. It's several $1,000s, and then
yeah.
they often tear the other side, and then they need another several
Oh,
$1,000s. Yeah.
that's crazy.
Yeah.
Yeah, that makes sense. I mean, and again, I'd heard that it lets their bones and everything mature properly when you
Yeah.
hold off. But yeah, knowing that it's probably best not to do it at all, that's definitely that's
Yeah.
new. So,
Yeah. Yeah.
yeah.
So,
Um, so you kind of touched a little bit on it already, is vaccines. And so maybe explain kind of the reality of dog vaccines. I mean, it's becoming a little bit more popular to talk about how we over vaccinate our pets today.
right, right. Well, I mean, vaccines can be an hours and hours topic, but
Yeah,
basically, I'm a minimalist when it comes to vaccines. The less, the better, and preferably none at all. I mean, the
yeah.
only one that's required by law is rabies, and that's one of the more damaging vaccines I see in medical practice. But what happens is young animals, puppies and kittens, are given multiple vaccines every few weeks from the time they're puppies or kittens, till several months of age, at a time when the immune system is developing. And during that time, what's been shown is that you can upset the gut flora and lead to a leaky gut, which again leads to, just like it does in people, all sorts of systemic immune issues and,
Yeah.
throughout the body, since the gut is the gateway to the body. So, these young animals that are being bombarded with the vaccines are suffering from, gut dysbiosis at a very young age. Um, but vaccines are often, I mean, trying to give you the bullet points, but vaccines are often given in combination with each other, multiple components in one. Most of the components in the combination vaccines aren't even necessary. They're either diseases that are very mild, or diseases that aren't seen very much, or diseases where the vaccine side effects are more risky than the actual disease. So most of the components in the combination vaccines, I don't recommend. Even canine distemper, which is an old virus of dogs, distemper is in the measles virus family. And measles back in the 60s, they used to have measles. I know measles is a hot term now with
Yeah, with
yeah,
human
yeah,
vaccines,
yeah,
yeah.
yeah. But back in the 60s, they used to have measles parties where kids would get together and get the measles and get lifetime immunity, chicken pox parties, that
Yeah,
thing. Even
I remember that.
my own
Yeah.
children were, we had a chicken pox party. But so distemper is a measles virus,
Okay.
and it's mostly mild in most dogs I've seen. It's not causing horrible pneumonias and seizures and brain damage and like vets, say, or it's going to kill your animal. So, it's a mild infection, and if they get it, they get a long-term immunity. In fact, one of my colleagues actually has finds out where distemper is occurring in the local raccoon population, and she'll actually send her clients' dogs to those areas so they congregate
Yeah.
and get immune, and then they don't have to, and they get naturally immune. So,
Mhm.
so distemper I don't really worry about. The only other, I mean, there's so many others that are given: hepatitis, parainfluenza, uh,
Yeah.
leptospirosis is a new one, not a new one, but is a infectious disease now that a lot of my colleagues are frightening people into getting the vaccine, saying it's this horrible disease that's going to kill your animal. And animals can get leptospirosis, but usually when they're unhealthy, will they get it? And the vaccine actually causes more immune problems than the actual disease does. So, so diseases like leptospirosis and Lyme disease and, kennel cough and canine flu and all these, these diseases, I can go through each of them, but they generally, the vaccines either aren't effective or they cause, immune issues.
Yeah.
And so when we inject these vaccines into our animal patients, we're actually bypassing totally the way the body evolved to keep infectious agents out of the body. In other words, through our oral cavity and through our respiratory tract, that's how our immune systems keep out, invaders. And when you inject something, you're actually giving the infection into the patient. So not only do you see side effects from the injection often, but
Yeah.
acutely, but even more commonly, we see chronic effects of the vaccine, and we call that in holistic medicine vaccinosis. And
Okay.
those are the symptoms that can occur days, weeks, months, even years later as a result of being vaccinated. And so, vaccines again cause a lot of immune issues. For example, rabies, as I mentioned earlier,
Yeah.
required by law,
Yeah.
but rabies actually causes so much immune issues in our animals, especially neurologically, behaviorally.
Mhm.
Um, it can cause seizure problems. In fact, again, the term vaccinosis means the symptoms of the disease in the actual patient. So we'll see anxieties and aggressions, and again, seizures and neurologic changes, and lower leg problems, paralysis and lower leg arthritis, neurologic issues in animals vaccinated for rabies. So
Yeah.
it's actually the symptoms over the life of the animal that we're seeing instead of, you know, the acute disease. So, as I said, rabies is, unfortunately one of those ones that's required by law.
Would any,
Yeah,
like, if it's required by law, would a state, and maybe this is by state, but does any state accept a titer test? Because I know even some dogs, and I could be wrong, I was told that some dogs are even born with rabies antibodies if the mother had rabies
yeah,
antibodies from getting the rabies vaccine.
yeah, no, that's true. I mean, there are some states that allow a rabies titer.
Hmm.
There are not a lot of them, but you have to check
Yeah.
with each local state. Um, a lot of states allow medical exemptions for rabies. So, for example, Florida, where I practice, is they allow medical exemptions for rabies. So, if I have a patient that has some chronic immune issues, even skin and ear problems,
Yeah.
digestive issues, hormonal issues, those patients I often will exempt from the rabies vaccine. Any history of tumors or cancer, that those animals can be exempt legally.
Yeah.
And, so that's an option for, you know, clients as well. Um, what else can I say about rabies? For the other vaccines, the disease parvovirus,
Yeah. So parvo and distemper are given together, correct?
yeah, with a bunch of other things typically.
Okay.
Yeah.
Yeah.
Hmm.
But so is parvo, that's one that I would always
Yeah.
think like, oh, if I gave my dog any vaccine, it would be parvo.
Yeah.
But then
Yeah.
I've,
So parvo vaccine is one that people could consider in susceptible animals, which are puppies under a year of age.
okay.
And those animals, um, we are susceptible to parvo. They can develop diarrhea, vomiting,
Mm.
dehydration, and sometimes it can kill animals. And it's very expensive to treat in the hospital.
Yeah.
So if you were going to wait to vaccinate an animal or consider anything, parvo would be the only one. And I would only do it by itself, not combined with all the others.
Other ones. Yeah.
And typically, instead of getting all that series of shots every few weeks, if you wait until an animal's 4 months of age and you give them one parvo shot, that gives them a long-term immunity.
Oh, wow.
And, the antibodies from the mother's milk interfere with the vaccination process in animals under 16 weeks of age. So a lot of those early vaccines aren't having any benefit at all. So if you
Int-
wait until they're older and you get the one shot, then that
Yeah.
gives you long-term protection. And that's the other thing. The immunity to a lot of these vaccines lasts for years, if not the life of the patient.
Yeah.
And it's there was a veterinary immunologist many decades ago, Dr. Ron Schultz, who wrote in veterinary textbooks and that the immunity lasts for years, if not the life of the animal, and yet the profession ignored his research, and vets continued to vaccinate every year, and now they're doing it a little less frequently, every 3 years. But
Yeah.
they don't you don't really need to do it that way. To vaccinate an adult or a senior animal for parvo when they're not susceptible is, not really necessary. Yeah.
Yeah. And I'll have to say, like with my veterinarian that I currently see, they were due, my dogs were due for distemper parvo, and I wasn't going to do it. And so I was kind of going in expecting for some pushback, figuring out how I was going to do it. And she's like, "Oh yeah, I stopped doing that for my dog after it was a puppy." And I was like, "Okay, cool. Thank God. I
Yeah.
I
Yeah.
didn't have to like go back and forth about it."
Right.
Um, if you, I've read that you can kind of expose your dog to parvo in a very small amount to build natural immunity. That kind of would scare me, I think, but is
Yeah.
that
I'm
possible or?
not familiar with that.
Okay.
But there is, homeopathically, sometimes people use what are called parvo nosodes, which
Okay.
are homeopathic remedies that
Okay.
are developed, from actual, animals that had parvo, and it's an energy medicine, and that's another option. Clients
Yeah.
can give like the parvo nosode during the first year of life to,
Okay.
hopefully prevent disease without or infection without the side effects of injecting the virus into the patient.
Okay. That's
Um,
cool.
so that's another, option. And then I have clients that don't use any vaccines. We just keep them healthy through a species appropriate diet, have them on certain herbal blends that, to keep the immune system and the detoxification mechanisms functioning well.
Yeah.
And some people choose not to get any vaccines. Definitely for people that choose to vaccinate, you don't want to do it, like I said, overdo it when they're young.
Right.
You don't want to do it when they're sick with anything, with skin or ear problems, or because again the immune system's busy dealing with
Yeah.
that. You don't want to do it, again, to middle age or senior animals that are, let's say, that have a medical history or that have a history of cancer or tumors, because the vaccines just, again, distort immune function.
Yeah.
And again, they've been shown to cause disease, days, weeks, months, years later. And unfortunately, most of the veterinary and human, most of the veterinary and the medical colleagues, don't appreciate that it's more than just a rare reaction. It's quite common. So, a lot of the hormonal conditions of the body, thyroid, adrenal, diabetes, a lot of these conditions are due to autoimmune problems that are often started by vaccination. Yeah.
That makes sense.
Yeah.
Yeah. Yeah. I mean, as my dogs have gotten older, that's what's really sparked my interest because I have one's 9 and one's 7. And so I'm like I've started to realize that I really want to change my approach on
Right.
how I
Right.
take care of them as they get older. And it's funny, rabies was the first one that was on my radar as far
Right.
as that it causes cancer. And so we've been doing the titer test, and my little toy poodle, his titers when we last did them, they were like 12.5.
Right.
They were
Right.
pretty high. And so of course the vet was like, "Well, like they could just be that today. Like by tomorrow they could be zero." And I was like, "That
Yeah.
doesn't make sense to me at all."
No, no. Most viral vaccines, like I said, the protection lasts for years, if not the life of the patient. Yeah.
Yeah. Which that makes sense. And so and again, a lot of people don't know. And so knowing that there's been more of a, a hunger for holistic pet knowledge. Again, one of the reasons why I wanted to have you on, because so many people have been asking me, well, what are you doing with your dogs? Like, how are you, taking care of them? So I'm like, I need to
Right.
have someone who knows more than me to be able to
Right.
talk about it.
Right.
So,
Yeah, no, absolutely. I mean, there are
yeah.
usually holistic options for all of these things, for fleas and ticks and heartworm medication.
Yeah.
I don't use any of those in my holistic practice. I basically recommend, natural preventatives or minimal. Healthy dogs really don't get clinical heartworm disease. It's mostly seen in animals in really poor conditions, like at the shelters or on poor diets,
Okay.
animals that
Yeah,
are
I
over.
want to talk to you more about fleas and ticks. I have one more question though about
Yeah,
vaccines.
sure.
And obviously this happens with human vaccines too. People just don't often think about it, but a 70-pound dog is going to get the same vaccine as a 5
Yeah.
pound little toy
Yeah.
poodle.
Mhm.
And so that's also like no wonder that these poor little dogs are getting all these problems.
Right, right.
Is like, are there vets who'd be willing to only give half of the dose to a little dog if they're
Yeah,
due?
yeah. Well, I mean, yeah, there was some studies done back in 2015 or so, somewhere back then. Dr. Jean Dodds, who's based out of California, she's been a bastion of, appropriate but not over vaccination for decades. She published a paper talking about how the half dose vaccines in smaller animals trigger the same immune response. So, you shouldn't give like a tiny dog the same dose as a large breed dog. Of course, all the vaccine inserts say to give the same dose to every patient. So, and then, many years ago, there was a vet, Dr. John Robb, who actually went to bat and went against doing it, and he lost his job and his this, and no, he became a promoter and an advocate for and a courageous guy to beat the drum about half those vaccines, and his movement was called Protect the Pets, and it's still around. I mean, and he has a list of vets that do lower dose vaccines or do titers instead of giving the vaccine. So,
Yeah.
that's what I try and do in my practice. So, yeah, the dose is definitely, you're giving a much more concentrated amount to a small animal. Yeah.
Yeah, it just doesn't make
Yeah.
any logical sense. Like just that alone, like even if you still wanted to vaccinate your dog, like just
Right,
that
right.
should make you think twice. Um,
Exactly. Yeah, yeah.
so yeah, so flea, ticks, and heartworm. And I was, for me, the biggest thing that was like a mind changer was that a lot of the medicated flea and tick stuff that you give your dog orally is actually making your dog, which is the host, toxic, so that fleas and
Right.
ticks, bite them and then they die. So yeah, maybe talk talk about those and what you do in your practice.
Well, I mean, yeah, I mean, they're getting more and they're stronger and stronger, these products. The flea
Mhm.
and tick products, they're now combining with heartworm prevention, like an
Yeah.
all-in-one. They're given orally, topically, and they are concentrated in the body and in the liver, and they affect our detoxification mechanisms.
Yeah.
A lot of these products are meant to be toxic to the nervous system only of the flea or the tick, but the experience has shown that, and it's even on the drug label, that it can cause seizures, and these products can cause seizures in animals, neurologic problems, behavioral issues.
Yeah.
So they are very, very strong compounds, and they don't just affect the nervous system of the flea or the tick. They can affect the nervous system of the animal, and if they're susceptible to neurologic disease or seizure disorders, they can develop that. So, so I try and steer clear of these things. And then the other idea is that, you give these products month after month, year after year, and they build up in the system, and they build up in the body and in the fat and in the, in the tissues of the body. And then you get toxicity again, liver, kidney issues, even certain cancers from some of these ingredients.
Yeah.
So, I try, and so pesticides do build up cumulatively in the body. So we want to
Mhm.
keep that in mind. Just like, giving vaccines over and over again and feeding poor diets, these practices add up. And over time, they wear down the immune health of the animal. And then you end up with a plethora of autoimmune diseases, allergies, cancers. And as
Yeah.
I said, in younger and younger animal patients. But, heartworm, you know, I mentioned earlier that heartworm is mainly a disease of, in my experience, compromised animals, toxic animals. But
Okay.
one of my colleagues wrote a book called "Vital Dogs Don't Get Heartworms," and he practiced in South Texas and
Okay.
didn't preach any heartworm, and he was in practice for many decades, and animals did very, very well. So heartworm disease is, again, a fear bug in a lot of clients, and veterinarians use that to convince people to use it, often year round. Um, 2/3 of the states in this country, heartworm isn't even transmitted, most of the year. It
And how is
actually,
heartworm transmitted? Because I
it's
didn't know this until recently. So
it's
I think,
transmitted by mosquito. It's got to develop, the larvae have to develop inside the mosquito.
okay.
And, the larvae develop and get to a certain stage. And when the mosquito bites the dog, the life cycle finishes off in the animal. Um, but, the average temperature has to be 65 degrees or higher for 30 consecutive days for mosquitoes to transmit heartworm.
Okay.
So in the northern 2/3 of the country, that's not happening. And yet clients are instructed to give year round heartworm. And again, it's a pesticide that builds up in the body month after month, year after year. So, you know, so when you look at it that way, you don't even have to use it most of the year.
Yeah.
And even the chemical preventatives often have a longer benefit than just a month. It actually, one dose can work for 2 to 3 months. So if you want to just give a couple of doses during the transmission season, you will be definitely cutting down on the amount of pesticide you're giving your animals versus people giving it year round, 12 doses a year, that it adds up in the body really quickly, you
That's a
know.
lot. Yeah.
And there are herbal alternatives for, heartworm prevention. Animals, there's companies like the company down here in Florida, my Paleo Pet has a wonderful heartworm parasite blend product that's
Cool.
very, very good. It's got black walnut in it and wormwood and other herbs that are anti-parasitic and
That's what,
anti-heartworm.
yeah, people would take for parasites. Yeah.
Yeah, yeah, exactly. So, there are always other options. For fleas, there's essential oils that are
Yeah.
very, very good. There's a lot of companies out there now that have wonderful essential oil formulas. There's a good one called Wondercide that I
That's what
like.
I use. I
Yeah,
love them.
yeah,
Yeah.
they're very, very good. There's other ones out there, Flea Hex.
Okay.
These are all excellent options. Food grade diatomaceous earth is another
Okay.
natural flea prevention and treatment, and it's a worming agent too, diatomaceous earth.
Would you give it to them internally or use it
You can do
topically?
it internally and
Okay.
topically. Yeah,
Oh, very cool.
yeah,
Okay.
yeah,
Awesome.
yeah.
And what are your thoughts on amber collars? Because I've been trying that out recently and I don't
I don't
know.
have a lot of experience with them, so I can't really comment. Yeah,
Yeah, I'm not sure. I mean, I still use the Wonderside essential
yeah,
oil, their little single like use topical that
yeah,
you put down
yeah,
the back, and that seems to work mostly well. I mean, that's the one thing I've been still struggling with fleas, like finding a flea or two on them. And so I've been
yeah.
just trying to be a little bit more diligent about checking or
Right.
I have a mist that I can spray on them before we go for a walk just
Sure.
to like give them a little added fresh protection.
Sure.
But yeah, that's I think has been the hardest transition. Doing things more holistically has been the flea situation.
Yeah. Well, as they get healthier, they hopefully become less susceptible to fleas.
Okay.
In other words, not every animal attracts fleas. You can have a multi-animal household and have one animal loaded with fleas and another animal you don't find any on it.
Okay.
So, flea, it's an energetic kind of susceptibility. So if we raise the vibration of our animals, through a more holistic lifestyle and
Yeah.
treatment regimen, whether it's herbs or homeopathics, and those animals are less susceptible to fleas. Or if you find them, they're just going to be a couple and they're not going to bother the animal
Yeah.
versus being infested.
Definitely. Oh, that's so good to know. Because yeah, I've been frustrated, and every now and then I'm like, do I have to switch back to the medicated one? And I really
Yeah.
don't want to. So I've been like just trying to hold out and
Well, if you
be on
have an active
top of it.
infestation, sometimes it's necessary to
Right.
use one of these products, and then go back to the,
The next.
because natural flea treatment takes time, and
Hmm.
it can take weeks to months, to get all the stages of the flea. So it
Yeah.
takes some effort. Yeah. Mm.
That is for sure. Yeah, I feel like you have to
Yeah.
be very
Yeah.
on top of it. Um, so supplements for dogs, what are some, like, obviously every dog's going to be different. Their specific needs at a given time are different, but what would you say are like some of your, favorite things that you recommend to, the dogs that you
Well,
work?
I mean, you want to be careful not to over supplement. I mean, there's a lot of
Right.
supplements out there.
Yeah.
Obviously probiotics always play a nice role in the health of the gut.
Hmm.
Certain pre and probiotic products that are out there, enzymes to, especially if they're on commercial, kibble
Yeah.
or cooked foods. Um, so probiotics, sometimes I'll use omega-3 fatty acids
Okay. Yeah.
to reduce inflammation in the body, and,
Hmm.
to help with the skin and the coat and the heart and the brain. And so I often will use the, omega-3s in practice as well.
Okay.
Antioxidants are another broad category of nutraceuticals that I'll sometimes use over the years.
Okay.
Antioxidants decrease inflammation and free radicals, which are produced as a result of aging and degenerative processes in the body, cancer. So antioxidants are certainly wonderful. I try and get as much, I've evolved over the years from a more supplement based person to more getting it from the foods.
Great. I was just gonna say, would you recommend getting the
Yeah,
antioxidants from giving them like
yeah,
wild blueberries or something like
exactly.
that? Yeah.
Exactly. And, even the probiotics, you can use foods like raw goat's milk
Oh, yeah.
or kefir,
Yeah.
and that gives the gut healthy nutrients for a healthy gut. Um, and, we can use ingredients like that. When it comes to joint problems, can use herbs, food-based herbs for joint issues or urinary tract issues, rather than synthesized supplements that are, packaged and marketed. And, often the body still has to process the supplements too, you know?
Right. Yeah,
Yeah.
exactly.
Yeah.
So in LA, obviously, like a little over a month ago, we had the bad fires and the air quality was so bad. And so, I've been trying to figure out what to like researching into what herbs to give my dogs just to help
Right.
support their respiratory health a little bit. What would you suggest for, all the LA based dogs who are dealing with the air quality having been so bad?
Yeah, that's a good question. So, I mean, usually the herb that comes to my mind would be licorice,
Okay,
for the help
interesting.
with inflammatory processes in the airways. I've used supplements in conditions like that. Like I'll sometimes use quercetin, which
Okay.
decreases inflammation in the very well in the respiratory tract. Um, you know, I try to, like I said, not over supplement them, but licorice is what comes to my mind as the first herb that I would use for kind of
Yeah.
dealing with inflammation in the airways. Yeah.
Awesome. Yeah, and obviously it's something that would be for short-term use while,
Yeah.
things calm down as all these
Mhm.
toxins clear out. So for some supplements, do you recommend like specific pet grade ones or like human grade ones are fine? You just adjust the dose for your dog?
Yeah, I mean, again, we all have our favorites. Again, I like this company down in Florida that, formulates these herbal foods, as we call them,
Yeah.
into, easily formulations to give. So, they have a liver kidney blend, which is wonderful, which has some wonderful herbs, like
Okay.
dandelion and milk thistle and other herbs that help with detoxification. And certainly all of our animals should be on, a detoxification herbal protocol, just like, people.
People, yeah.
Um, so, and then I try and use homeopathy, which is based upon the symptoms of the patient,
Right.
and prescribing remedies to put the body back into balance and lessening the tendency to symptoms of acute or chronic disease. So, yeah.
Yeah, that's awesome. I know homeopathy is so fascinating. I love homeopathy.
Yeah.
So another question I have is, what are your thoughts on like plastic toys for dogs? Like, obviously, I mean, at first thought, I'm like, I don't like to do that, but I know I've had some people asking me what your thoughts would be on plastic chew toys for dogs, if those
Yeah,
should be
yeah.
avoided.
Well, plastic, again, just like I'm unfortunately drinking out of now, it's not
Yeah,
really the best thing for, when plastics are heated,
of
there are
course.
toxins that are released into the product.
Yeah,
And obviously plastic toys are, they're synthetic. I mean, they're not natural, so whatever they're, adding to the process of making them probably shouldn't be in our animals' bodies. So
yeah,
they chew on them and then they're going to get in dose of these things. So try and stay away from those if you can.
yeah.
Stick,
So I
stick
would
with
even
stick with raw meaty bones as treats.
okay.
Mhm.
Yeah, definitely.
Yeah.
Because yeah, what comes to mind too is one of my dogs loves like the Nyla bones, and I mean I don't really do them anymore, but like they
Right.
would just go to town and swallow those little rubber pieces, which obviously
Sure.
it's kind of a plastic. It has to be a plastic base. It's not just
Right. Right. Yeah.
so yeah,
Yeah. So yeah, like I said, I try to stick to more natural chew things like bones and you know those kind of things. Mhm.
yeah. And then kind of one more thing, like as this is kind of common sense, but I'd love to just to hear you talk about it is like water source. Like a lot of times we don't think about the water we're feeding our dogs. I mean, I'm kind of a stickler. I feed my dogs the water I drink, which is spring
Right.
water.
Right. Right.
So how important is your dog's water source for their
Yeah, I
health?
mean, I need to be better on that myself, but like I said, the water is important. My colleague, my paleo pet, who's a nutritionist, he's always on me to really focus on the water. Obviously alkaline water or you know, water that's not chemically
Right.
altered
Yeah.
in plastics and that kind of thing. So yeah, water is important. It's the number one nutrient in the body. So
Yeah.
like I said, alkaline water is very, very good. And you don't want and if you can get your water in glass formulations instead of plastic or again, that's your expertise.
Yeah.
Yeah,
Yeah. But yeah, it makes sense. But all of it's so fascinating. I mean, obviously there's so much overlap to human holistic health and dog holistic health. A lot of the
right,
philosophies that you would apply to our own
right,
health, we
right.
should be applying to our pets' health,
Yeah,
but somehow a lot of times it gets overlooked because we just think our pets, oh, they're animals, they're resilient, they'll be fine.
right.
But they need a lot of the same care and
Absolutely. Yeah.
attention to health as we give ourselves.
Yes, yes. Yeah. Yeah. And it's like I always say, everything you put on or in the body
Yeah.
has an effect. So whether it's topically or it's ingested or it's injected, like with the vaccines, or through the food or
Yeah.
applied, so any orifice of the body you're applying something to,
Yeah.
can affect the body. So that's why I try, you want to look at the holistic health of our animals by being mindful of the vaccines, the diet, the pesticides, the heartworm, and the less they're exposed to a lot of these toxic stressors, the less we're going to have autoimmune diseases, chronic skin and ear problems, and
Yeah.
digestive issues and cancer. And those diseases are epidemic in our animals today, as I mentioned at the outset.
Yeah, definitely. And you mentioned topically too. I've been like the shampoo that the groomer uses on the dogs is super perfumey, and I'm realizing like that's fragrance, that's toxic. Like I should probably switch to a more like natural shampoo because
Yeah,
their
yeah,
skin's absorbing that when they're getting
absolutely.
their
Yeah,
baths.
yeah, yeah.
So all these
There's
little
definitely,
things that
yeah,
you
we have
think
to,
about for yourself, but not
yeah,
for your
yeah.
dog.
You have to be mindful for sure. Yeah, yeah.
Yeah. Well, awesome. Well, all of this information was super helpful. To
Right.
kind of wrap up the episode, I like to ask my guests some rapid fire questions, and so some of these will actually kind of pertain to like your own health, and then some will apply
Boy,
to pet health as
really
well.
a driller here. Okay.
Yes. So my first question is, what's your go-to breakfast for yourself in the mornings?
I'm just gonna say I'm not like I said. I mean, I have like a fresh protein shake.
Okay.
So that's what I usually drink. Yeah.
Awesome. And then on my podcast is the fruity podcast. I'm very fruit based in a lot of my approach. And so I always ask all of my guests what's their favorite fruit.
Uh, Probably the sweeter ones. Probably like cantaloupe or yeah,
Amazing.
that's probably
Yeah.
my favorite one. Yeah. Mhm.
Awesome. And yeah, and you live in Florida. There's so much great fruit there.
Yeah,
So,
yeah.
yeah.
Yeah,
Awesome.
I need to use your services. So I'm not a cook, so I don't do great with you know, with my own. I had to be a little
Wait,
better with my diet. Yeah. Mhm.
that's funny. So yeah, so you were very focused on all the pet's health and diet that you tend to neglect yours
Well,
sometimes.
yeah. I mean, I buy, from Whole Foods and that kind of thing, but
Okay.
I know that doesn't mean it's better.
Yeah, it's
Um,
a little better.
yeah, yeah.
Yeah.
But I mean, yeah, I need to utilize more like the cooking services. So,
Yeah,
yeah.
yeah,
Mhm.
absolutely.
Yeah.
So you kind of obviously touched on supplements, but what would you say, and I think you kind of answered this question, but is the number one supplement everyone should give their pet, like regardless of, what they're doing? Like,
Well, I mean, you're talking about like a product, I mean, or a class of supplements, or
well, I mean, I'm guessing it'd be a probiotic. That's
yeah,
my
yeah.
guess of your answer,
I
but
mean, there are some good companies out there now. Again, it's expanded. There's one called Visbiome,
mhm.
which is a good one.
Okay.
Visbiome.
Okay.
There's another company called Adored Beast, which has some really nice probiotics. So there's good ones, but yeah, if you were going to ask for one supplement, so to speak, I would
Yeah.
say probiotics would be the one. Yeah.
Awesome.
Yep.
And then what are you most hopeful for about the future of pet health?
Well, increasing awareness of, chronic disease in our animal patients. Some of the issues I brought up here on the show, like
Yeah.
less vaccines, better diets, more mindful use of chemicals and preservatives. So, I'm hopeful that that wave will continue in the future, and more veterinarians will think more holistically rather
Yeah.
than just putting everything you can into the body without any thought about it. So,
Yeah.
that would be my kind of, you know, wish for the profession moving forward. Yeah.
Yeah. Awesome. That's great. And do you foresee, like, again, I'm just going to say rabies because it is the one that's required. Do you foresee that changing at all in the requirements? Because obviously there's not very, I think, I don't know if it was in the state of California or in the United States alone, there hasn't been a single rabies case in dogs in like 14 years. Do you
Yeah.
foresee the regulation around that ever changing?
Yeah, probably not because it's a human health risk.
Okay.
So
Yeah.
rabies, I mean, there may be more states allowing titers. I mean, there
Okay.
was a study done several years ago, done by the Rabies Challenge Fund, which
Mhm.
showed that the immunity to rabies vaccines lasts for many, many years, at least 5 years, if not more.
Okay.
And so hopefully the laws will extend out a little bit or allow titers and, of course, exemptions. Hopefully.
Yeah, absolutely. Yeah,
Yeah,
I feel like allowing titers would be a huge game changer if
yeah,
states would
yeah,
allow that. Then if, if you have it just once in their lifetime and then they have titers for the rest of their life, then that
right,
would even
right.
help their quality of life as they get older too.
Absolutely. Yeah.
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 Awesome. Well, is there any other topic that you'd like to share that I didn't ask about? I feel like I kind of
Um,
covered most of them,
yeah,
but
I mean, there's a lot of stuff in an hour.
yeah.
No, I mean, I think we've covered most of the main topics for sure. And hopefully
Awesome.
this information is useful for the audience. And certainly
Yeah.
for my own practice, I do, many of us holistic veterinarians consult by telemedicine.
Oh, you do telemedicine.
We
That's
do
great to know.
yeah,
Okay.
I work with clients all over the country, and I get the symptom history, and if there's any labs that are needed, I can evaluate those. And then, again, we use herbs and homeopathy to instead of strong drugs and chemicals if possible. Yeah.
Awesome. Well, that's great to know.
Yeah.
Yeah,
Yeah.
that's
My website has all the information about my practice.
yeah. So how do people
Uh,
find you if they
Yeah.
want to
Yeah.
book a appointment with you?
My website is drdym.com. That's doctordym.com. And that has my contact information, my website information, and articles and some videos. So, yeah.
Awesome. Great. And I'll be sure to link the his website in the show notes and as well as some of the other brands that he mentioned today. I'll put all
Yeah.
of that in the show notes so you guys
Great.
have all of that.
All right.
Yeah. Well, thank you so much
All right.
for taking the time to talk with me and share your expertise on holistic pet health. This has been
Absolutely.
it's been super enlightening.
Sure. Okay.
Awesome.
No worries. It was great to be here.